most of her life with her husband in Arlington, Texas. 2 years ago, her daughter had twins, so Rebecca started spending more time in Austin to help her daughter and son-in-law take care of the babies and to help around the house. For years, Rebecca had a problem with her eyes. She wasn't able to see close objects clearly, and the problem was getting worse. One day, she tripped on some steps while coming up in dim light and fell hard. The next day, Rebecca's daughter convinced her to make an appointment for an eye exam. Rebecca arrived for her appointment with her ophthalmologist, an older doctor with a gray beard, Dr. Emmanuel Sullivan. After a series of tests, Dr. Sullivan concluded, "Rebecca, we have some good news and we have some bad news." "Give me the bad news first," Rebecca replied with a smile. Dr. Sullivan explained that she had significant myopia, or nearsightedness. "But the good news is that you're a candidate for laser eye surgery." He explained that laser eye surgery was a pain-free procedure that could be done in 15 minutes and offered long-lasting results. Rebecca agreed, and Dr. Sullivan scheduled her for the following Thursday. On Thursday morning, the ophthalmology meeting was more tense than usual. There were 2 procedure rooms with lasers, and one of the machines wasn't working. To accommodate all of the patients, Dr. Sullivan and his colleague Dr. Mason would have to share the same room. When Rebecca came in for her procedure, she felt nervous, but the procedure was really quick, and she took the rest of the day off. Dr. Sullivan had explained that she might experience some vision problems that day, but he told her that everything would be normal the following morning. But Rebecca still couldn't see well the next day, or the day after that. She started to worry and decided to call Dr. Sullivan to find out what he thought. Dr. Sullivan reassured her that sometimes symptoms like blurry vision can be part of the normal healing process, and that in rare cases, it can take a month or 2 for the vision to fully normalize. He encouraged her to see him at the end of the month. A month went by, and Rebecca still couldn't see well. She felt terrible, and she was worried that she had become a burden for her daughter, who was already struggling with the twins. Rebecca arrived at the hospital and complained to Dr. Sullivan that her life over the past month was much worse than before the surgery. "I feel so useless. I can't see price tags. I can't watch television. I barely recognize the time on my watch." Dr. Sullivan was worried. He went through Rebecca's files and discovered that the laser surgery settings were incorrect. They had been set for Dr. Mason's patient. There was potential for permanent injury to Rebecca's eyes. Dr. Sullivan told Rebecca what happened, and the conversation left Rebecca feeling furious as well as frightened. She stormed out of the office, and within a few weeks, Dr. Sullivan received a letter stating that he was being sued for the laser surgery procedure that he had performed.